Hello students, today we will have class on neonatal seizures. Neonatal seizure, it's a most common manifestation of neurological dysfunction in the newborn. In the few previous classes, everywhere neonatal seizure was discussed as a complication. Okay, तो मतलब it's a situation which should not come in any newborn's life. But if it comes, then what all management we can do and how we can care for a neonatal seizure baby is what we are going to learn today. Neonatal seizure is a paroxysmal behavior caused by hypersynchronous discharge of a group of newborn. Or in simple words, you can say that seizure is the sudden, abnormal and excessive electrical activity in the brain. Okay, so neonatal seizure usually occurs during the neonatal period, during the first week of baby's life. Okay, and they are considered as provoked seizure rather than a true epilepsy syndrome. That means प्रोवोक्ड शीजर्स मीन्स कहीं ना कोई एक कॉज रह जाता है जिसके वजह से ये शीजर न्यूबॉर्न में होता है. ओके, देन विल बी डिस्कसिंग द वेरियस टाइप्स ऑफ नियोनेटल शीजर. बेसिकली देर आर 4 टाइप्स: सबटल शीजर, टॉनिक शीजर, क्लॉनिक and myoclonic. Okay, subtle seizure basically affect the preterm and term babies, and you can see the common symptoms like eye deviation, blinking, fixed stare. फिक्स स्टेयर मतलब एक ही जगह पे देखते रहता है. रिपीटेटिव माउथ एंड टंग मूवमेंट. ओके, एपनिया, पेडलिंग एंड टॉनिक पोस्चरिंग ऑफ लिम्प. ओके, tonic, it is basically seen in preterm babies, may be focal or generalized, and tonic extension or flexion of limbs you can see. Focal और generalized मतलब क्या होता है? Focal seizure वो होते हैं जो it's a kind of partial seizure जो किसी एक area of brain को affect करते हैं, and generalized मतलब the whole brain is involved for the particular seizure. Okay. Third type, clonic, it also affect the term, maybe focal or multifocal. Multifocal means partial seizure is occurring because of various area affected in the brain. Okay, इसमें clonic limb movement दिखेंगे, consciousness may be preserved. Myoclonic seizure is very rare. It may include focal, multifocal or generalized. Lightning like jerks of extremities you can see in myoclonic seizure. Okay, so these are the 4 basic type of seizure. Subtle seizure, then tonic, clonic, myoclonic. Okay, then we'll be discussing the various causes of neonatal seizure. जैसे कि मैंने शुरू में ही बोला, neonatal seizure can have many cause. Okay, but the first and foremost cause is the lack of oxygen resulting in asphyxia, which may occur before, during or after birth, right? तो एस्फेक्सिया किस किस कारण से हो सकता है? प्लासेंटल एब्रेशन, prolonged labor, compression of the umbilical cord. Already we have discussed this topic, right? Then infection also can lead to seizure, that is meningitis, encephalitis, torch infection from mother to baby. Then certain electrolyte imbalances like hypoglycemia, hypocalcemia, then hyponatremia, that is less sodium level, and hypernatremia, that is more sodium level in the blood. Then certain conditions like stroke before and or after birth, venous sinus thrombosis, bleeding in the brain, congenital brain abnormalities, right? Then some condition like drug withdrawal, if the mother is taking alcohol or cocaine, so sudden withdrawal from the drug can also cause. Then certain intracranial hemorrhage or metabolic disorder in newborn. Okay, so all this can have a complication that we call as neonatal seizure, right? एंड इलेक्ट्रोलाइट इम्बैलेंसेस में सबसे कॉमन एक हाइपोग्लाइसीमिया होता है, दूसरा होता है हाइपोकैल्सीमिया. ओके, सो इफ दीज ऑल प्रॉब्लम्स आर नॉट ट्रीटेड ऑन टाइम, देन इट विल रिजल्ट इन अ कॉम्प्लिकेशन विच वी कॉल इट एज न्यूनेटल शीजर. ओके, जैसे कि हमने टाइप्स देखे, तो हर एक टाइप के अपने अपने सिम्टम्स है. So we'll be discussing symptoms. Subtle seizure में random or rolling eye movement, eyelid blinking or fluttering, eye rolling up, eye opening, staring. Okay, then sucking, smacking, chewing or protruding tongue may be there. ये सब हमको normal लगेगा, right? But it's a type of seizure. There are unusual bicycling or pedaling movement, thrashing or struggling movement, okay, and long pauses in breathing. That is called apnea. Apnea आप लोगों को पता है ना? If breathing cessation is there for more than 20 seconds, then only we say it as apnea. Then symptoms of clonic seizures are rhythmic jerky movement that may involve the muscles of the face, tongue, arms, legs or other regions of the body. Then symptoms of tonic seizure may include stiffening or tightening of the muscles, turning the head or eye to one side, bending or stretching one or arms or legs, right? Then symptoms of myoclonic seizure may include quick single jerking motion involving one arm or leg or the whole body, right? So it depends upon कि कौन सा type of seizure है, accordingly you will find out the symptoms, right? So I think all the symptoms are very clear. Basically we cannot easily recognize neonatal seizure, right? Because कुछ कुछ चीज़ें ना हमें बहुत common लगता है, हमें लगता है बच्चा खेल रहा है, but actually it can be a type of seizure. So you have to be very alert. Then the common diagnostic tests included are electroencephalography, that is EEG, okay. Then laboratory testing like serum glucose, electrolytes, cerebrospinal fluid analysis, urine and blood culture. क्योंकि लेबॉर्ट्री टेस्टिंग किस लिए होगा? इन्फेक्शन चेक करने के लिए, राइट? हाइपोग्लाइसीमिया या इलेक्ट्रोलाइट इम्बैलेंस तो नहीं है, ये चेक करने के लिए, इन्फेक्शन है कि नहीं वो चेक करने के लिए, राइट? Then MRI, CT scan, imagining test also we need to do to find out whether there is any kind of congenital or acquired condition in the brain which is actually causing this seizure. Okay. Next we'll be discussing the management. The first and foremost thing is that neonatal seizure requires urgent management or urgent treatment. Why? Because we need to prevent brain injury. Okay, so कौन सा टाइप है इससे मैटर नहीं करता, but everything need a urgent treatment to prevent brain damage. Okay, and before starting anticonvulsant medication, okay, we have to maintain adequate ventilation and perfusion, and also blood glucose concentration should be normal. Okay, so you have to make sure that give anticonvulsant medication only after adequate ventilation and perfusion have been established and blood glucose concentration have been measured. Okay, the first thing is that you have to see for adequate ventilation and perfusion, that is giving enough supply of oxygen. Then correcting metabolic disturbance, hypoglycemia, I have already taught you hypoglycemia, so you have to manage hypoglycemia by 2 ml per kg IV bolus followed by a continuous infusion up to 8 mg per kg minute intravenously. Hypocalcemia, calcium gluconate 10% you need to give 100 mg per kg IV over 1 to 3 minutes, and here you have to monitor for bradycardia, okay, following with a maintenance dose of 500 mg per kg per 24 hours IV or oral. Okay, so after managing and having the ventilation and perfusion in a normal level only, you will go to start the anticonvulsant therapy. So the first line anticonvulsant drug that we use is phenobarbital. Okay, 20 mg per kg IV you need to give. If necessary, additional 10 to 20 mg can also be given. Okay, likewise you have to monitor the blood pressure and respiration. Okay, फिर इसका मेंटेनेंस डोज 4 to 6 mg per kg per 24 hours IV और पर ओरल हम मेंटेन कर सकते हैं, ठीक है. लेकिन 40 mg per kg से इतना इंक्रीज करने के बाद भी अगर फिनोबार्बिटॉल इफेक्टिव नहीं है, then you have to go for the second drug of anticonvulsant called as lorazepam. Okay, lorazepam 0.05 mg per kg से 0.10 mg per kg IV several minutes के लिए आप देंगे, and meanwhile you will see क्योंकि respiratory depression तो नहीं है. Okay, and लोराज़ेपम देने के बावजूद अगर मैनेज मतलब बेबी रिस्पॉन्ड नहीं कर रहा है, देन ओनली यू विल कम टू द थर्ड लाइन एंटी कन्वर्जेंट, जिसको हम फिनिटॉइन बोलते हैं. ओके, तो फिनिटॉइन में 20 mg per kg IV diluted in 0.9% sodium chloride you have to give. Monitor cardiac rate and rhythm, and maintenance 5 to 10 mg per kg for 24 hours IV you need to give. ओके तो ज़्यादातर क्या है, फिनोबार्बिटॉन में ही ये सही हो जाता है. लेकिन अगर ये सही नहीं हुआ, देन ओनली यू विल कम फॉर द सेकेंड लाइन एंटी कन्वर्जन, थर्ड लाइन एंटी कन्वर्जन फिनाटॉइन. ओके, इसके अलावा यू हैव फोर्थ लाइन एंटी कन्वर्जन, जो बेसिकली हम यूज़ करते नहीं है. Okay, we only use it in recommendation with a neurologist. Okay, that is paraaldehyde. Okay, so that also you have an option.